Welcome to the Core Women Podcast, the place for women entrepreneurs, authors, and self-starters looking to build community and gain valuable insights through expert interviews with women at the top of their game. Join your host, podcaster, producer, expert coach, entrepreneur, and author, Dr. Summer Watson, as she aims to inspire and empower you through these candid conversations. Lean in and embrace the journey. It's time to start the show. Here's your host, Dr. Summer Watson.
Welcome to the Core Women Podcast. Today's guest is Janelle Miller Moravek, who is a nonprofit leader and mental health advocate who has served as Executive Director of Youth and Family Counseling since 2009. Janelle has led the organization's growth and expanded access to critical mental health services across Lake County, Illinois, while building strong partnerships throughout the community. Her leadership extends beyond her organization through her work with the Lake County Alliance for Human Services and the Behavioral Health Action Team. In this conversation, we talk about what it really takes to lead in the nonprofit space, the realities of mental health access, and how we can begin to close the gaps that so many individuals and families face. Welcome, Janelle.
Thanks for having me.
Absolutely. It's a pleasure. I'm excited to roll into this, but before we dive into your professional journey, if you could describe your life to this point in one word, what would that word be and why is that word important to you?
I'm going to say accidental.
Interesting. Okay.
I kind of land into things and just figure it out. And then it takes me someplace else. And I'm like, oh, here I am. I'll figure this out now. So mostly my professional life has been not planned.
All right. Accidental. I think that's really the first time I've heard that one on the show, and I've had over 400 episodes. So I'm sure we will uncover more of the reason for that word. Janelle, what drew you into the nonprofit arena and mental health space, and how has that passion evolved over the years for you?
It's accidental.
All right, let's expand on that.
I will try to be succinct. I never intended to work in this space, to do the work that I do. When I was in college, I was a French studies and international relations major. I was going to go study abroad in France, marry a Frenchman, and never come back. But that did not happen. I ended up falling in love with a guy who's a high school teacher, and he was a football coach. And those people don't exist outside of the United States. And so I said, okay, there's one true love, and I'll figure out something else to do. So I did. I went off and got my first few jobs in fundraising, which was what I had learned through my student work study job in college. So I ended up in fundraising, was doing that, got married. We were wanting to start a family. And I was like, I don't want to work in this really big, lots of hours, capital campaign fundraising job that I had. I was looking for a step back, and there happened to be a part-time development job at this little counseling center right where I live. So I applied. I became their first ever development director, and I worked for 20 hours a week. And I did that for 6 years. And I didn't know anything about mental health before I started working here. And along the way, learned all about mental health and the amazing impact it has on people and their lives. And I had my own experiences as a consumer of mental health services. So when the executive director stepped down in 2009, I said, I want that job. Here's why I want it, and here's what I would do. I was frustrated. I wanted a better plan. I wanted to go bigger. And the board said, knock yourself out, have at it. And so in 2009, I stepped into the executive director role, and it has been an amazing adventure as the leader of this organization. We've grown up together in so many ways. And I've had the amazing ability and grace to figure things out and to grow and to help evolve this organization into what I feel the community needs. And I say that as someone who's a consumer and as someone who works here. I feel like there's often a disconnect between the two worlds. And I see a lot of my role as bridging that gap. If I run into another mom in my community and they hear what I do, they're like, oh, that's good. And then we'll probably hear from them later on, hey, I have a question. And they're texting me or reaching out quietly on the side. wanting information about how to navigate, or how did I know my kid was ADHD, or how did I know that my daughter needed a higher level of care? Or if they're looking for a marriage therapist, what should they do? Why is this information a secret? And so I've started just talking about it. And I feel like that's a big part of the barrier that's preventing people from getting the right help when they need it is they don't know. They don't know what the behavioral healthcare system looks like. They don't know what levels of care are. They don't know how to find the appropriate provider. And so, based on my own experiences, I'm just trying to change that one day at a time.
Well, let me take a step back here for a moment because I do want to delve a little bit into your own mental health journey and your own experiences with access to mental health. So, can you share a little bit about that and how that has impacted how you lead this organization?
Yeah. As a nonprofit, I am proud that we offer health insurance to our employees. I personally am covered under my husband's plan. I am not untypical of our human services workforce. I'm white, I'm middle aged, I'm upper middle class. I can afford to work in the human service sector where the wages are not always at market. And I've never had any problem accessing care because my husband's company is covered by Blue Cross Blue Shield. That's the biggest insurer here in Illinois, and almost everybody is in network. They're also one of the best payers of commercial insurance. And so oftentimes you'll find here private providers who say, I only take Blue Cross Blue Shield.
Mm.
So I say that to explain that I have not encountered an affordability or an access based on my insurance. But I also know that that's not the case for everybody. In Illinois, over half of the private providers in behavioral health and substance abuse are out of network. So that makes them expensive for most people. And then if you're covered by Medicaid, it's even harder to find a provider. So I know, because of what I do here at work, I know how to navigate insurance. I understand that that is that first driving force of, all right, I have to decide or understand how I'm going to pay for services before I try to go and find a provider. Because the kind of provider or where you go is going to depend on what kind of coverage you have. So I use that when I'm helping other people. I also know that you access services for a whole bunch of different reasons. I discovered personally that I was anxious. When I realized that in my 40s, it's like a huge light bulb went off. And managing that through medication and skills has been life changing. That was me. My son is ADHD. And so we needed a different kind of therapy. When we realized that, I knew to get tested and then exactly what kind of provider I needed to find in order to equip him and me and my husband as parents with the appropriate parenting skills, techniques that would work for him. He was different than my other two. I have 3 kids. And I had a daughter who had a major depressive disorder, and she needed that higher level of care. And that was really hard. I didn't know those things exist. And I work in this space. And it was only because I work in this space that I was able to literally step out of my office and say, I need some help. I don't know where to go for this. And I have an amazing intake team. And she came in and she's like, okay, here are 5 options for you. And here's what you probably are going to want to ask. I don't think most people, consumers, have access to that kind of help. And so, because I've seen how hard it is, especially when it comes to our kids, I don't think that moms talk a lot about the struggles of their kids. Like, we don't jump up and say, my child is having suicidal ideation and I think I need some help. They might say that anonymously in a Facebook post, like, I need help. But generally, people aren't out there saying that. It is our story. It's not our story. So they're looking for that information in a discreet way. And how can I give it to them and meet them where they're at? That's become an important challenge that I've taken on.
Well, thank you so much for taking on that challenge and also talking about your own experiences and your access to mental health. And, each person has their own challenges. And I think many times it's that first step of even reaching out, understanding the access to care not having access to insured care. What does that look like for that person, right? And then
Yeah,
on top of that, you get the predominant issue, the mental health issue. That's a struggle in itself just to maneuver that and then to pick up a phone or to go talk
right,
to somebody or to
right.
even get out of bed or to
Yes.
even take a shower. I worked in the mental health field for several years. I started a nonprofit. So I know when you talk about
Yeah.
pay, I started at $10 an hour, okay? And with a master's degree. So,
Hmm. Hmm.
so how is that supposed to get you anywhere, right?
Right.
And
It's
and
not a
yet
living wage.
it's not a living wage, and it is working for an organization and for a calling that was really important to me to help people maneuver through a system or to afford care and working with communities and bringing them in to find out their needs. But anywho, I think what you're doing is amazing. So you have spent over a decade leading one organization, which is not something we see often these days. What has kept you committed, and how have you continued to grow both the organization and your leadership within it with your team?
Well, selfishly, I work and live in the same community. My house is 6 blocks away. So while I was raising kids, I did not want to leave because this workplace, super convenient. I think there comes a point where it requires bandwidth to go look for a new job. And I never had that. And I didn't want to leave. And always YFC has been growing. So when I stepped in 2009, our budget was $600,000.
Okay.
Today we're 2.8 million.
Okay.
So we have grown a lot. And I think I probably led 4 different organizations in the last 15 years because at each stage, it's been a little bit different, right? Our staff has looked a little bit different. I channel my inner Taylor Swift and I talk about my eras, but there are 4 eras. And each one of those has had its own challenges, ups and downs, successes. I haven't had to leave to get something new, and I've been really lucky. And at the same time, it's also provided me with an amazing opportunity to try again. One of the measures that we look at is, I say clinical productivity, but it's that percentage of that clinician's time. What's that right balance between direct service and non direct service hours? And how do you find that right balance so that it's meeting the needs of the organization? We're a fee for service organization. So I need direct service hours to get paid, and it's not burning out the clinicians. They're able to meet targets relatively easily without feeling overwhelmed. I've tried, I think, 3 times in the last 10 years to figure that out. I think I finally gotten it right this time, right? You have to develop the model, you have to test the model. Each time it takes a few years. So having the tenure, in my opinion, has meant that YFC's growth has accelerated because I'm the same leader. So you never have to take that pause and plateau to bring on new leadership. We're just continuing along up the curve. I don't know if that makes sense.
Oh, it does make sense. And I like your rationale. One, geographically, where you're located, that makes sense, right? You like where you live, you're a mom, and you
Yeah,
have, access to your work that's pretty close, right?
yeah,
Then on top of that, you've been with the organization for a while, so you've seen these different iterations of how the business has grown. And
yeah.
we all go through that as business owners, whether you're nonprofit, for profit, we have those iterations because of generational issues and how we communicate, innovate, and just work together.
Mm-hmm. Mm-hmm.
Now, you've evolved this organization where you've got a front row seat basically to how the nonprofit sector has evolved, is working in society today. So, my question is, what changes have you seen, and where do you think there is still work to be done?
YFC, like most nonprofits, is 2 businesses in one, right? It's the business of being a nonprofit, which has its own rules and needs its own infrastructure. And then there's the business of our mission, which is counseling services, clinical services. We have to have both of those businesses all in one. And there is incredible change happening in both of those landscapes. It's an exciting time. It's an incredibly challenging time in the mental health field. Think about how quickly the knowledge we have about behavioral health, what drives it, how to address it, is changing. It's still a relatively young field. You have the flooding of digital and new technologies. with all of the opportunities and all of the risks that they present to our society. You have a world where people are not well, and it's showing up in all different kinds of ways, from our young children to our parents in their workplaces. It's across the board.
Mm-hmm.
And in the nonprofit field, it's increased competition, more demand for services. So, how do you thread all of that through one needle? I think there's so much more that we can do. I think we're looking at systems level change because all of the micro factors are happening too quickly. They're like bamboo, they'll always be there. It's these today, it'll be something else tomorrow. I think we need to look at the systems level, and we're starting to do that at YFC. For example, we cannot have enough appointments. There's not enough staff. Even if I had all the money in the world, there still aren't enough professionals to hire. That's a systems level problem. So what can we do to develop and strengthen and diversify the workforce so that it is adequate to meet the need? I think that's where the change has to happen. And when you're talking about affordability, I think there's change that has to happen in the reimbursement model. But that is change that is going to take partnership between private insurance, government, and providers all working together. How are we going to get that done? Because at the end of the day, if people can't afford services, they're not going to get it. The needle is not going to move. If we want to move the needle on addressing the mental health crisis, we have to look beyond micro level factors, and we have to start looking at the systems that hold innovation back.
Yeah, you're absolutely right. There are multiple factors that influence how you provide services and what kind of ties your hands as well. And so all these have to work in congruency with each other. And sometimes that's out of whack, meaning the way you get funding, the way you do direct service, the number of employees that you actually have, training. I mean, there's just so much in regards to that wheel working and working effectively. And so it sounds like you're doing a magnificent job. My next question for you is, and thank you again for your answer.
Mhm.
For someone who has never accessed therapy or feels like it may not be an option for them, what would you want them to understand about mental health care today?
It is an option. First of all, there should be something for everybody, no matter where you live. The good news is mental health care is everywhere. The first step is you need to say something to somebody, whether that's picking up the phone and calling 988, which is that national crisis line, and the people on the other end of the phone are trained and can guide you to the right place, right? They can validate, they can suggest, and they can give you a great next step, whatever that is. In a couple of weeks, we'll be going live with YFC's new website, which will have an atlas. I call it an atlas, which is a book of maps, right? A map, and it's of our behavioral healthcare system. And that is our latest attempt here at YFC to put out in the universe all of the knowledge that we have here at YFC about how to understand your symptoms, what they might tell you about your level of acuity, how that would match up to the behavioral healthcare system, and then how to navigate to that appropriate provider for you. It's a lot. It's just information. It's not a directory, but it's an attempt to equip our community with the information they need to be effective in navigating the system.
I love that approach and that atlas. That is
Yep.
fantastic because that's exactly what people need. They need to be given direction step by step where it leads to the system or that system because people have never been in it. And when you're in potentially crisis and you're a family member or you're the person looking for something, you want to be able to navigate that because that is also overwhelming. It is exhausting and it can add to that hopelessness if they can't find the help they need or the direction that
Yes.
they're supposed to go in. So I love that response to the need for access. So thank you for that. There is a growing conversation around the shortage of mental health professionals. What do you think is driving that shortage and how is it impacting access to care in communities?
It's hard work. As you said before we jumped on, you have to have a lot of schooling. Master's level therapists need a master's level, right, to diagnose and to create a treatment plan. That's expensive in and of itself, not to mention You are going to have to, at some point in that process, do a clinical practicum or a clinical internship that's going to require you probably to work unpaid for 20 to 30 hours a week, which means how are you going to support your family if you're the primary wage earner? And so I think that we need to increase wages. We need to address the workforce. I think that's how we're going to move the needle.
Yeah, I think that's so true. Again, it is a statement on the profession of the importance that's put on it in regard to the allocation of funding. There's so much we can talk about here in relation to mental health, access to care, how it's growing, how it's being stunted. There's so much because, again, the decision makers a lot of times are those that don't know the system, haven't been in the system.
Right.
And you're just like, oh my gosh. And to speak to what you're saying about being an unpaid practitioner or learning to be a practitioner and you're the primary breadwinner of your family. Yes, I had to have two, a internship and a practicum without pay.
Nobody else does that.
And when you did get paid, it was $10 an hour in the nonprofit sector. So it's like, how long can you actually afford, even though you might love and be passionate about the mission, how long can you afford to work in that when the pay isn't there? It's not equivalent to a living wage.
So we have to have real adequate reimbursement rates that are paid so that we can provide the salaries we need to attract and retain the talent in the field.
Right.
And by that, I mean not bright, white, middle-aged, second income earners. I can afford to work here. A lot of people can't.
Right.
And that's a real problem.
Yeah.
Because that is access. And listen, and it's hard work. Therapists sit in a room, they listen to other people's stories. Here at YFC, we like to say, don't go in the pool, stay on the pool deck, right?
Yeah,
But
absolutely.
But it's really hard not to go into that pool when the stories we hear are awful and they're hard. And being able to be fully present with a client in the room, they're going to see 5 or 6 a day. That is hard work. And then there's the administration.
Mm-hmm.
There's the note taking, the documentation, the diagnosing, the case management. We're mostly women in this field. And then we go home and we take care of our own families. And then we wonder why we burn out. It's a really hard field.
Oh, yeah.
And so one of the things that we're working on here at YFC is manageable work and boundaries so that I can have a staff that comes back day after day, week after week, year after year, because that's what the community needs. It needs the consistent care because some of our clients need to be able to come back and not have to tell their story again to a new provider, right? You want to be able to do a new episode of treatment with your same provider.
Yeah, absolutely. Because that also means that if that person is having to see somebody else, that is one less session that they get to be able to talk and get out what they need to. They have to retell their story. And sometimes retelling the story is re-traumatizing. That work on both ends for the consumer as well as for the caregiver, the clinician, is extremely hard. And I always believed, Janelle, that the thanks that I got was that person coming in and being in that seat. It wasn't, oh, thank you, Summer, for being there, or thank you, Dr. Watson. That's not what you're going to get. You're going to get them showing up.
Absolutely. Them coming back. Yes.
Them actually taking medication if they need medication, them actually responding to behavior modification and doing the work.
Yes.
Those were the thanks. Those were the internal things that I was like, yes, yay, high five. So we have covered a lot today.
So much.
We could go on and on because I love this, not just the subject, but the intention, the meaning, the mission, right? And so as we come to the close of the interview, my last question is for leaders, advocates, or individuals who want to make a difference in mental health access, what is one practical step they can take to support change in their own communities?
Be that person, be that bridge. If you're a manager, be that trusted person. And then when you notice something, ask and offer support. Take a mental health first aid class. Learn how to recognize the symptoms. I don't think it's fair that we ask people experiencing mental health challenges to self-refer. We should be a kinder world and notice and create that open space. So I think if there's one thing anyone could do is be that bridge for somebody else, because you never know. You never know.
I agree with that. Well, thank you, Janelle, for joining me on the Core Women podcast today.
Summer, thanks for having me.
It's a pleasure. You can connect with Janelle Miller Moravek on LinkedIn and at counselingforall.org.
Thank you for joining us on the Core Women podcast with Dr. Summer Watson. We're so glad you're here and would love to connect more with you. Find us on Instagram, Facebook, and YouTube at Core Women, and on Twitter at Core Women 1. For more about Core Women and Dr. Watson, visit corewomen.com. Want more support and resources for amazing women like you? Great! Join Dr. Watson and Jen Fontanilla at the Life, Love, and Money Collective, a Core Women production that aids in understanding the key traits that might be getting in the way of living a life that you are absolutely passionate about. Connect with Summer and Jen and find out more at thelifeloveandmoney.com.